orders here at the nurse's station. I'm to do a med nebulizer, 2.5 milligrams of albuterol and 500 micrograms of Atrovent via nebulizer every 4 hours. Got my flow meter, actual nebulizer kit with medications, pulse ox, and something to write with, as well as my stethoscope here. Okay. Knock, knock, knock.
Yes, come on in.
Hello, my name is Jake. I'm a respiratory care student, and your doctor has ordered a med nebulizer for you, and I'm just here to administer that for you.
Okay.
Okay. Okay. Before we get started, can I get your name and date of birth, please?
Charles Asante, 0202 17.
Okay. Look up here real quick, and we'll get started. If you wouldn't mind, I'm going to go ahead and check your ID band real quick, just to make sure. It's Charles Asante, 22-1970. Okay?
Mm-hmm.
And then I'm going to have to get your vitals before we get started, just to make sure where we need to be.
Okay.
Just kind of hold steady there. And it takes a minute to get ready. There we go. And I'm just going to make sure that we're on the same page with this guy, because sometimes the heart rate doesn't quite add up. We're just going to leave that on you, because we just need to monitor your heart rate while the medication is being administered, just in case there are any adverse reactions, which shouldn't be a problem, but we just want to make sure. Okay, if you can take your right arm and just kind of hold it over your chest for me, if you would. I'm not telling the patient that I'm checking the respiratory rate, but that is what I'm doing, just so they'll breathe normally. Then I'm going to go ahead and raise your bed up, put the rail down, and then kind of get you in a seated position, as comfortable, as high up as we can get you comfortably. So I'm going to need to listen to your breath sounds before we do the treatment, so I can do a before and after assessment. If you'll just breathe deep for me. Okay, and just another deep breath. One more. Another one. Breathe deep. And then last one up here. There we go. And then if you'll lean forward for me, I'm just going to do the back too. Okay. Deep breath. And then just a deep breath. Deep breath. Deep breath. Deep breath. And then a deep breath. All right, thank you. Go sit back if you want. Okay. Your doctor has ordered the nebulizer treatment. We're going to do this every 4 hours. So once we're done here, you'll see me again in a little while. This is the 2 milligrams of albuterol, which is just going to go in there first. And then this is the 500 microgram Atrovent, which we're doing at the same time. mouthpiece with my hand here since it's gonna go in your mouth. Okay, so what you're gonna do once we get this started, you're gonna see some vapor coming out of both ends. That's just the medication. You're gonna wanna take the mouthpiece and then just kind of put it in between your lip and between your teeth, but just don't bite down. Form a nice tight seal around your lips, and then just kind of you're just gonna breathe normally, and then every so often just take in a deep breath, and then just kind of keep going that way.
Okay.
So we're gonna set this to 8 liters per minute, and then you're just gonna kind of hold that. Like I said, good. Nice tight seal with your lips. Just breathe in, and then every so often, just kind of take a deep breath in. And this treatment should only take about 15 or 20 minutes or so. Now it sounds like we got some sputter here. I'll take that from you real quick. Get that medication. Yeah, and then just like normal, just breathe normally. Kind of deep breath every so often, just kind of deep breath. Let's see, it's been about 5 minutes. I'm gonna go ahead and reassess the heart rate there, which looks to be good. Pretty much exactly the same. Sounds like we've got some sputtering again. I'll go ahead and take that if you don't mind. Just kind of slap it on the side to get that guy working as best we can. Just kind of breathe normally, and then every so often you're just going to take a real deep breath. Okay, so it sounds like we got the final act of the sputter. It's been about 15-20 minutes for the medication. All right, sounds like we're done. I'll go ahead and take that from you. Just kind of take this guy apart, and this is going to kind of just stay in the room with you because this is yours. Put this guy back in here. And we'll just dump the residual amount out the sink, and then do the same with the tubing just so it doesn't get all clogged up in there. I need to reassess your vitals again, but before you do that, if you could give me a nice strong cough into that. Alright, let's go take a look at that real quick. Okay, like I said before I go, I gotta reassess your vitals, so let me go and take a look at that guy again. Okay, if you could just put your arm over real quick for me, I'll just take this one off. Just like before, we're just going to do listen to your breath sounds there, just to make sure, see if we got any different sounds from before the treatment. Just kind of sit up straight and then give me a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And then deep breath. And then just like before, I want you to lean forward so I can get the back. Okay, just take a deep breath in there. And And then a deep breath. And deep breath. Deep breath. Deep breath. And then just one more deep breath there. There we go. Okay. And like I said, they ordered this for every 4 hours, so you'll see me in about 4 hours to do this again. And it's going to be pretty much exactly the same as before. You go ahead and lower your bed back down, put your rail up. Are you fine seating? You want to lay back down?
Okay, like this.
Okay. All right. Here's your call light. If you have any questions, go ahead and don't hesitate to hit that button. Your nurse will come and see what you need. And if she needs to come find me, she will do that.
All
All right. Is there anything else? Do you have any questions for me?
right. No, I'm good.
All right. Well, I will see you in about 4 hours. Chart this.
I'm going to do first.
Okay, and then I got my charting there for treatment and be back to see him in 4 hours.